What are the new TBI diagnostic biomarkers in blood? Imagine being able to tell if someone has a brain injury just by a simple blood test. That's what new research in traumatic brain injuries is bringing us. For a long time, diagnosing brain injuries, especially mild ones, depended on symptoms and scans. But sometimes these methods miss subtle or delayed injuries. Now, scientists are developing blood tests that can give clear, objective proof of brain damage. This is especially useful in personal injury cases, where showing proof of injury can make a big difference in compensation and care. A biomarker is a substance in the body that signals the presence of an injury or disease. In traumatic brain injuries, when brain cells are damaged, they release specific proteins and molecules into the bloodstream. These molecules act as markers, showing that the brain has been hurt. Unlike symptoms, which can be vague or delayed, biomarkers give a measurable, scientific indication of injury. The main blood biomarkers for traumatic brain injury are called glial fibrillary acidic protein and ubiquitin carboxyl terminal hydrolase L1. Glial fibrillary acidic protein is found in support cells in the brain called astrocytes. When these cells are damaged, the protein leaks into the blood. Ubiquitin carboxyl terminal hydrolase L1 is present in neurons, the brain's nerve cells. When neurons are injured, this protein also enters the bloodstream. Elevated levels of these markers can show brain tissue damage even if a scan looks normal. In 2024, the Food and Drug Administration approved several blood tests for traumatic brain injury. These include Abbott's iStat TBI plasma test and bioMérieux's VITAS TBI test. The iStat test is quick and easy, giving results in about 15 minutes using a small blood sample. It's designed for emergency rooms to help decide if a patient needs a computed tomography scan. The VITAS test takes around 40 minutes and uses serum, a component of blood. Both tests measure the levels of glial fibrillary acidic protein and ubiquitin carboxyl terminal hydrolase L1 to assess brain injury. These blood tests are becoming more common in hospitals, especially in emergency departments. If the biomarker levels are low, doctors might decide that a scan isn't necessary, saving time and reducing radiation exposure. If levels are high, further tests and monitoring can be done. This approach helps doctors make more accurate diagnoses and can be especially helpful in mild traumatic brain injury cases where symptoms might be unclear or disputed. For personal injury claims, these biomarkers are a game changer. They provide objective evidence of brain injury, which can be very helpful if symptoms are vague or if the injured person disputes the injury. Blood biomarker tests can also help show how severe the injury is and track recovery over time. This information can support claims for ongoing medical care or disability benefits. However, these tests are not yet perfect on their own. Medical organizations recommend using them alongside clinical assessments and imaging. Some doctors still prefer traditional methods, but the use of biomarkers is growing. Researchers are also exploring other potential markers like S100B, neurofilament light chain, and microRNAs. These could offer even more ways to detect brain injuries in the future, possibly through saliva or urine samples. For lawyers and clients involved in traumatic brain injury cases, understanding these blood tests can be very helpful. They can provide clear, scientific proof of injury that supports a claim. As these tests become more common, they may change how medical evidence is presented in court and how injuries are diagnosed and treated. These new blood biomarkers are making it easier to confirm brain injuries objectively, which benefits everyone involved in personal injury cases.